topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, South Florida, my home backyard. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. You know, you never know who is watching the show. We start promoting our shows about 2 days out on YouTube. And I got a call yesterday from a gentleman that our Dr. Cherry, our great expert in neuropathy, treated about 2 years ago. And he said he is one of the greatest doctors. He helped my mother, and I'm glad he watches a lot of our shows. He said, I am so glad you've got Dr. Cherry. I was shocked, but let me introduce you to one of the top doctors when it comes to neuropathy, which I have learned so much about over the last 2 years. Good afternoon, Dr. Cherry. Dr. Cherry? Okay.
Dr. Cherry, are you here with us? It looks like you are having internet issues, Dr. Cherry. Continue on.
Okay, so we're waiting. You know, this is what happens. We do a live show. I prefer live over pre-recorded. Dr. Cherry is having some technical issues today. Of all times, because I really wanted to hear about the phone call that I got. I don't know if Dr. Cherry can hear us or not, but I can see that we definitely have technical problems. Let me give it a few more minutes. Dr. Cherry.
Here we are.
Here he is.
I'm sorry.
That's okay. Did you get to hear
No.
about the phone call that we got?
I would just cut off right then. So,
Oh, of all times. So, Dr. Cherry, we started promoting your show on YouTube several days out. We got a call from a gentleman by the name of Mark, but you didn't treat him. You treated his mother. And he said when he saw you were going to be on the show, he said, you got the greatest doctor. My mother was suffering badly from neuropathy, and Dr. Cherry treated her, and she is doing wonderful. He just said, I watch a lot of your shows, but when I saw Dr. Cherry was coming on, I had to call you and tell you he is the greatest. What a compliment.
that's great. I love to hear that. That's awesome.
Of course. So, Dr. Cherry, tell us about your practice. You practice here in South Florida.
Yeah, thank you. I do practice in South Florida. My office is located in Cooper City, which is South Broward County, Southwest Broward County. And I'm a chiropractor of 33 years, and we help people that suffer with, well, any types of musculoskeletal pains, including nerve pains, anything from accidents to injuries to chronic pains, arthritis, disc problems. We use a non-medical approach. We find the root cause of the symptoms and we treat where it's all coming from. That's why we're super successful at having people respond to our treatment. And, many people don't really understand the benefits of seeing a chiropractor, even if they've been to a chiropractor. So one of the first things that I do with each patient is I sit them down and do a consultation and explain to them what chiropractic care is all about, how the body has the potential to heal itself, And we're going to find out what's preventing that, remove that interference, and promote natural healing. It's amazing how the body heals itself. With neuropathy, by the way, people that have nerve damage, it's problematic because the nervous system itself is the control center of our bodies. And when I'm talking about the brain, the spinal cord, and all the nerves, so if there's actually damage to these very small nerves in your hands and feet, it takes time and it's difficult to get it to get better. But we do have a 97% success rate when patients follow our recommendations. That's why that patient, Mark's mother, did really well, because she was committed and she followed the plan exactly right. And those are the kind of results we get.
So, Dr. Cherry, I've got to compliment you. You brought up you're actually a chiropractor. I am so amazed what chiropractors are doing now. You guys are so ahead of the curve. You are literally saving people from having to do surgery. You are doing things that that doctors want to treat you with medication. And I'm just so amazed what chiropractors are doing now.
Yeah, it is, and it always has been an amazing treatment to help people, get healthier. And I do want to remind people that are watching this podcast that, chiropractors, myself, I am a healthcare provider, a holistic, natural healthcare provider, helping people restore their health naturally and advising on the components of health, which most people are aware of, but just don't do a good job at implementing. Such as eating the right foods and why, and the proper exercise, the proper sleeping habits, having a healthy nervous system, of course, reducing stress. We go back to the basics and help people start to implement those strategies along with our treatment in office, even out of office. And everybody has the potential to heal. It's amazing. On the other hand, medicine, unfortunately, in my humble opinion, it does not treat the actual cause of the symptoms. My job is to find the root cause. We treat that, and that's why people have the ability to respond well. It's just a different approach, and most everybody needs it, no matter if they have pain or not. It's all about being healthy and improving the system that controls your health. That's what we do. That's what we want to help everybody with. And so this is what makes it successful.
Do you see yourself coming under the heading also of functional medicine?
Some chiropractors focus on the functional medicine aspect. I do not at this moment in time, but that the guys that specialize in that and focus on that do very well as well. Again, that's all based on the premise of helping remove interference from the control center, the nervous system, and get your system to respond well.
So we get a lot of text messages during the time you're on the show until the next time you come on the show. And a lot of the questions are people like who live in Palm Beach Gardens. Do you do any type of telemedicine? Can neuropathy be treated through telemedicine?
Yeah, we get that question a lot. And of course, we'll be glad to speak to somebody on the phone. But when it comes to neuropathy, not only do we need to speak to you and help you understand the anatomy of the nerves, what parts of those nerves are actually damaged, causing the symptoms, but we need to explain the treatment itself, what that involves, where you do it. And so a telemedicine or teledoc visit is just not enough. We actually have to perform an examination so we can determine that it is actually neuropathy. And in doing so, we'll test the hands and feet, wherever the body part's involved, the different nerve fibers to see how they respond to the different senses that they send to the brain, such as hot and cold and vibration and light touch and sharp, etc. In doing that, we'll figure out which nerve fibers are damaged and an overall level of, severity. And based on that, we determine what treatment protocols are necessary. Now, just so everybody knows listening, most of the treatment that's done once I diagnose you with this condition, most all treatment is done from the comfort of your home. We use
Oh.
devices to help improve the circulation to the nerves. We use a device that helps speak the language of nerves. We use very specific nutritional supplements that our private lab developed for people, and some office treatments. That's usually the routine, but most everything is done from home. So even if they live in Palm Beach, and we have people that come from everywhere, they're not local. I'm not going to expect them to do the office treatment once, and then they'll show up for the re-exam. And in that time, we find that on average, people are at least 30 to 50% better, if not more. And there's a lot of people that are better than 50%. And that's important to understand, people, that most of the treatment you do from home, there are no side effects. It does not hurt. It's super comfortable, actually, and relaxing. And there's different things that we use and different devices we use. So that's why you do need an exam, so we can give you the best treatment options to get those results.
So the number one question that we get now, since we put on there treating neuropathy, we are getting so many people saying, what is neuropathy and what causes it?
Yeah, of course. Well, neuropathy is nerve damage or disease of the nerves. And we're talking about peripheral neuropathy. And that means the nerves that are furthest away from your brain and your spine. That's your feet and your hands. And the pains tend to work up from your feet, up your leg, or from your hands up your arm. And the main cause is diabetes. And the reason behind that is because the extra blood sugar, it is like shards of glass passing through your bloodstream and blood vessels, damaging the lining of the blood vessels, not allowing enough blood flow, which carries oxygen and nutrients, to these very small hair-sized nerves. And that actually damages the nerve itself, the nerve's cover, the nerve fibers, and leads to all the symptoms. Outside of diabetes, another common cause is chemotherapy. That causes a lot of neuropathy. And we do get good results. I say good to great results with people that have chemotherapy-induced neuropathy, but it's a timing thing. The sooner we catch it, the sooner we start treating it, the better results we get. Other reasons are autoimmunity, accidents and injuries from the past that catch up to us, poor metabolic health. We may not take the best care of ourselves in the course of our lives. And of course, as we get older, things come out. It's usually from our history, our past. These are really the most common reasons. There's even unknown onset. That's super common. 10 to 15% of the time, we just can't pinpoint what caused it. But it doesn't matter what caused it. It matters that we find it, that it's not permanent, and then get you into that 97% success rate and start improving your life and your independence and enjoy yourself, because everybody deserves to enjoy themselves. They don't deserve to be suffering in pain, and they certainly should not be taking medicine that is not designed to help these nerves heal, which causes side effects and prolong the recovery. So yes, it's extremely important to find it quickly and treat it.
So Dr. Cherry, some of the letters that we've gotten, people have gone to their MD, and their MD has told them that they're stuck with it. And that is just not true, is it?
You know, it's super frustrating for patients to have the doctor that they rely on primarily give them a drug that's not designed, number one, for nerve damage. It's designed for epilepsy and seizures. And I'm talking about gabapentin, people.
Yes.
And then the next go-to drug is Lyrica. Same thing, basically. They're not designed for neuropathy. The doctors, these medical doctors, they mean well, but they just, honestly, I've been doing this decades. They do not know how to treat this condition. And if they don't know how to treat it, unfortunately, they tell their patients there is no cure. You have to live with it. And it's a terrible, terrible thing that I deal with every single day with patients. I have to tell patients, kind of funny, I have to ask them to please remove everything they think they know about medicine and health from their minds and pretend like we're going into first grade and you're about to learn everything about everything when you come to my office, and teach them all about nerves and the anatomies and the treatment that treats that, and why people get better, so they can make an educated decision to actually improve their life, improve their health, because it is something that can reduce significantly, if not 100%, if we catch it soon enough. regardless of what these medical doctors say.
Well, we're getting tons of text in. Here is Mary and Davy. She wants to know, once I start your treatment, how long does it take till I start noticing a difference?
Great question. Really good question. What we find on average, it usually takes anywhere from 4 weeks to 6 weeks for most people to start to report that they're noticing an improvement in their symptoms. Now, that also can happen in just a week of treatment or a few weeks. There are averages, but mostly within that 4 to 6 weeks period of time, people will start to report improvement. That is a really good question. And again, in 3 months' time, most people are at least 30 to 50% improved, if not more. And that's the time we would do a re-examination and actually demonstrate improvement as well. Good question.
Do you see a certain demographics of people who suffer from neuropathy?
Yeah. Yes. I mean, well, it can happen to anybody. As far as demographics go, age certainly has things to do with health problems. So, of course, I'm always recommending that everybody take the best care of themselves or better care of themselves step by step. But age is a problem. There's different cultures that come from different countries and islands, and I attribute it to their lifestyles that they have in these countries, such as, for instance, I have patients from Jamaica and the Bahamas and Trinidad. Wow. And I think it's something to do with their upbringing, their culture. They work hard, their diets, just their lifestyles. And that, I think, has a lot to do with that as well. But then again, it can happen to anybody, and you might not know why. It's something that occurs, and it's unfortunate, but there is an answer. Everybody needs to get to my office for a consultation. It's free consultation to talk about this and then give you all the information on what it takes to get better.
Kurt and Aventura, I am so glad I found your show. I think my mother is suffering from neuropathy. My question is it seems like my mother is worse at night or when she's resting. Does that have anything to do with neuropathy?
You know, it's a really common situation or concern for people, extremely common. Most of the time, I attribute it to the fact that during the course of our day, we're a bit distracted by our daily life. And then when it comes evening time, as you wind down and try to get in bed or relax, those distractions go away, and now the symptoms are more prevalent. I attribute it to that. You're just not focused on your daily tasks. And unfortunately, this condition is super uncomfortable in the evening time. Just having your feet under the covers can cause burning pain, an increase in burning or numbness. Yeah, it's super unfortunate, but you can still get better.
Hey, Dr. Cherry, since we started doing the show, and this is how my crazy mind works, you know, we're always hearing about auto accidents or people who put their foot on the gas and ran through a wall, people slipping in the shower. And I think about the numbness that happens when you have neuropathy. And I wonder if some of these people have neuropathy and don't know it.
Yeah, a lot of people don't know it's neuropathy. There's certain types of people, like men, who don't like to go to doctors. They can fix everything themselves, and they start developing health problems and symptoms related to that, and they think they'll go away, and sometimes they do. Neuropathy, unfortunately, when it starts to come on, with the first symptoms are typically numbness or tingling or any derivative of that, like pins and needles and prickling. That is a pretty strong indicator, and it is not normal to not feel things properly. That we need to try to get you in for the free consultation. The reason that people develop that numbness and tingling is because, there's a covering over the nerves called a myelin sheath, and its job is allow for electrical conductivity across the nerve. And when that cover, that sheath, gets damaged, those signals can't pass across the nerves properly, and that leads to the numbness and the tingling sensation. And then if you let that go long enough, it becomes worse, and other symptoms like burning or electric shock or cramping, freezing, any and all combinations ensue. We need to take this seriously if somebody has these symptoms and come and find out a little bit more about what's going on. And again, that is why I do offer for everybody an absolutely free consultation to discuss what's happening with them and exactly what we're going to do to help them get better. So I hope that everybody can take advantage of that. I do want to mention that I see the number is scrolling across the bottom of the screen. Even my cell number is there. The 754-227-9640 is the office number. We can take calls during regular business hours and be glad to help anybody who needs help for themselves or somebody they love.
Here is Naomi in Coral Springs. I saw where the show was going to come on today. I was going to tune in for a few minutes. I'm still watching you. Thank you for such a great show. My question is, you just mentioned the medication. Is that masking the symptoms? Or are they fixing the problem?
The medications gabapentin and Lyrica are designed from the pharmaceutical industry to dampen the signals in the brain to reduce epilepsy and seizures. That's what it was designed for. You can easily look that up on Google or any source you use. And dampening the signals is not a way to reverse the damage that is done to the nerves to help you heal. It is just a symptom relief, if at all. And unfortunately, as any pharmaceutical drug, there are side effects that are not healthy. And why take that drug that's not for the condition that you have if you can experience, severe side effects? It just doesn't make sense. What makes sense is finding what's causing all this problem and treat that. And that's what we do.
For all of you who are watching on YouTube, we are scrolling the number in the website. For all of you who are listening on iHeart, Spotify, our radio, W4CY, all the audio, tell people how they can reach you again.
You can reach us by calling 754-227-9640. Again, that's scrolling on the bottom. You could reach us on our website. It's www.drandrewcherry.com. You can request an appointment right on that website. It's very simple to see. You can find me on Instagram. You can find me on Facebook. You can find my YouTube channel at Dr. Andrew Cherry DC. You can watch patient testimonial videos, 30 seconds to a minute. There's hundreds of them. It is phenomenal what people say in their own words about the results they get. It is very easy to find us and contact us. And we hope to help everybody that needs it.
I want to get this last question. Dr. Cherry, what other chronic pain do you treat?
We treat chronic pains in the neck, in the back. We treat the whole body, every joint, everything you could think of, anything related to arthritis or just chronic old injuries to just aging pains. We treat many, many, many health conditions. There's my cat.
Dr. Cherry, you are so good at what you do. Dr. Cherry will be back again with us next month. But if you missed part of the show and you want to go watch it, just go to iHeart or YouTube under Ask the Experts South Florida. And Dr. Cherry, I'm glad we got everything straightened out. And we'll see you next month.
Thank you very much, Steve. Thanks for having me. I appreciate it.
Dr. Andrew Cherry, folks, I'm telling you, if you are a family member or a friend is suffering from neuropathy, he is the best. That's going to do it for us today. Thank you, Rebel, for getting this taken care of. You're the best. We'll see you all next week.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.